absolute pleasure and a privilege to be awarded the Fenner Award, and I'm really thrilled to be able to deliver the Fenner lecture in front of my colleagues, friends and family. Frank Fenner is an eminent Australian microbiologist who was instrumental in the eradication of smallpox. And smallpox causes this quite devastating illness, which causes 30% fatality in individuals who are infected. And the way that smallpox was eradicated was by using a vaccine. And we know that vaccines are really effective in preventing viral infections. So like smallpox, HIV/AIDS is a major public health problem. And there's an estimated 33 million individuals living with HIV. And of those individuals who are infected, 50% of the individuals are women, and that reaches greater than 60% in sub-Saharan Africa. So unlike the situation in Australia where HIV is spread from men who have sex with men, on a global basis HIV infection is really a heterosexually transmitted disease. Now, unlike HIV, we don't have a vaccine. It's been 30 years since the virus has been discovered, and we really don't have an effective vaccine for HIV. However, there is talk of the possibility of an HIV/AIDS-free generation. And the reason for this rhetoric is major advances in the last 2 years in HIV prevention. And this includes the Caprica 004 trial, which evaluated topical microbicide for the prevention of HIV in women. And this particular trial was rated one of the top 10 scientific breakthroughs in 2010 in Science magazine. This was followed by an IPREC study, and in this study they showed that oral pre-exposure prophylaxis, so using an antiretroviral agent as a tablet in uninfected individuals, could prevent transmission of HIV in men who have sex with men. And that was rated Time magazine's top 10 achievements in 2010. And then we have treatment for prevention, the famous HPTN-052 trial. And this is where HIV-infected individuals were treated early with antiretroviral therapy compared to late treatment. And this resulted in a reduction in the transmission of HIV to uninfected partners. So there are other modalities too that we know can prevent sexual transmission of HIV, male circumcision, the treatment of sexually transmitted infections, which we know can enhance HIV infection. Condoms can work in addition to HIV counselling and testing, and some obscure modalities as well, which I doubt would work. But the underlying premise here for the ability of these prevention strategies to work is human behaviour. That's going to underpin whether these modalities are actually going to be effective in a real-world setting compared to what we've seen in these clinical trials.